Ask an Advocate with the Pennsylvania Coalition Against Domestic Violence. I'm Lauren Duff. I'll be your host today, and we're going to be discussing domestic violence prevention, in particular, community-based prevention. So joining us today, we have Nick Silveri-Hiller. He's the prevention manager here at PCADV. And we also have Bruce Harlan, the CEO of Women's Services, Inc. From Crawford County. So thank you both for joining us for this discussion today. And I really want to just hop right in and have Nick tell us about the background of domestic violence prevention and what the journey of PCADV's prevention work has been.
Yeah, thanks, Lauren. And I'm really stoked to be here, excited to be here with everyone. So basically the background of prevention is I'll first quickly define prevention, and it sounds the definition is exactly what it sounds like. It's stopping something, and so in this case, domestic violence, before it has the opportunity to occur. And so we really believe, and we kind of we believe that prevention is possible, that intimate partner violence and these other forms of violence aren't, inherent to human relationships, and that we can build, a better society from the community up that's based on equity and respect and peace. And so PCADV began prioritizing violence prevention back in 2007. And that's when we first developed a 5-year statewide violence prevention plan that helped kind of guide our prevention efforts from 2015 to 2020. And so we have 3 kind of overarching goals from this plan. First was to increase state and local resources available for the primary prevention of domestic violence across PA. Second, elevate the profile of primary prevention of domestic violence as a public health issue. And then third, and finally, Pennsylvania will work together to bring about the social change necessary to end domestic violence. So over those 5 years, from 2015 to 2020, we did make a lot of huge gains in those 3 categories by increasing our pass-through funding, by meeting and and working kind of cross sectors at the state level to bring kind of Pennsylvanians together. And then in 2021, we released a new state action plan that was developed in collaboration with our state leadership team, which is across a multi-sector statewide group of folks that come together to discuss domestic violence and how to prevent it. And so we worked collaboratively to create our new state action plan that I'm really excited for.
Awesome. Can you tell us a little bit about the new plan, and have there been any shifts in the focus or what that looks like now?
Yeah, so the goals are still the same, those 3 goals that I mentioned. But we've learned in the past, many years, we've learned so much from, the public health field and other, social movements about addressing social inequities and what that needs and what that takes. So in the past, prevention was primarily focused on, educating folks about healthy relationships and warning signs of unhealthy relationships. And of course, this is still really important work that, is important and should be happening. We found that there's also other strategies from the public health field that really get at the root of the social injustices that are causing these forms of violence to happen in our communities. So we are kind of been shifting towards, instead of only education and raising awareness, but changing the actual environments in which people live has been more effective and has had a longer term positive effects for our communities. So a quick example is, for example, there was a study on a program or on a curriculum that had kind of an in-classroom component, and also they did hotspot mapping to see how to basically ask the students where they felt safe or unsafe in the school, and then the students, color coded it, green being safe, red being unsafe, and they used that information to make policy level decisions in the school to make it more safe. And what the research showed was that the classroom interventions only had a very limited effect and was very short term, versus the classroom interventions had a longer effect and made a greater impact in decreasing, in this case for this curriculum, it was sexual harassment, which is a risk factor for intimate partner violence. Excuse me. So we see that, really changing the environment has a much larger impact. And there's a slogan from the National Resource Center on Domestic Violence that I really love. That's awareness plus action equals social change. So of course, awareness and education is really important, but without action, it won't create the social change that we want to see.
I love that. And that example is so cool, and such a kind of thinking outside the box from what we normally think of when we think of domestic violence prevention as just that education portion. So a little bit ago, you mentioned pass-through funding. Can you discuss what that means and what that process looks like? Like, what's PCADV's role, and how do the local member programs fit into the picture with the pass-through funding programs?
Yeah, so one of our major focuses in the prevention team is to find funding and resources for our local programs to do this type of community level work. So we have tweaked it over the years. We've changed it a bit. We're trying to, work with our local programs and kind of figure out where they are, what they need, but also kind of helping build up their capacity for community level work. So we have the past several years have had several mini grants that go out to local programs, and with the goal of kind of helping them build capacity for these community level prevention projects.
Awesome. And it's my understanding that, Bruce, you and your program have received pass-through funding. So making the connection at the community level is key. And your organization, Women's Services, Inc., I know has done a really great job with this. Can you discuss the HOPE project and why that community buy-in has played such a big role in its success?
Sure, but I'm going to have to start the story 10 years ago. I'll keep it brief. So back in 2011, actually, this community here in Crawford County, and we're operating in Meadville, which is the county seat, and Crawford County is the county right below Erie. So we're tucked up here in Northwest Pennsylvania. We had a trauma conference. I think it was covered or paid for by SAMHSA funds. And we attracted 150 colleagues and allied professionals from all over the county. Well attended, very enthusiastic. And then after the conference ended, nothing happened. So we did it again in 2013, 10 years ago, where this story really begins. Only this time, we met at the end of the conference. And again, I think we had over 200 people show up. This time we decided we better have some next steps outlined and defined so that we don't just wither on the vine here. And one of those was a local organization had just recently applied for and gotten funding to do trauma-informed work in the community with a half a dozen organizations. And that really got the ball rolling, and it got people thinking about trauma and how it impacts our work and impacts the folks that we're interfacing with. And then in 2015, we started a group called Peace for Crawford, and it was fashioned after a group in Tarpon Springs, Florida, who was billing itself as the first trauma-informed community in the nation. And I think what they meant by that was they were investing a lot of time and energy in getting everybody in the community trained on ACEs and what trauma looks like and how it's to be managed in your community. So we started a similar effort here called Peace for Crawford. And over the next 5 years, we probably got 7,000 people trained. This includes school teachers and school administrators, law enforcement, first responders, the Human Services Department. We're actually continuing this work, and we're training all 80 city employees over the next month and a half. And then as the norm shifted from asking, what's wrong with you or what's wrong with people, to what happened to you or what happened to this community or what happened to this neighborhood, then it began to force local systems and norms to look at those overarching conditions that really contribute to trauma, such as poverty and racism and patriarchy and homophobia and transphobia and all those issues and all those isms. And that really got the community talking, and we got more buy-in, not just from the human services community, but from local businesses, the education department, Allegheny College, which is here in our community. And around that time, we realized we need more data. And so we started collecting data that was publicly available and easily gotten. So we're looking at arrest records and overdose deaths, and we're looking at domestic violence incidences in the aggregate. We're looking at sexual assaults. We're looking at ambulance responses. And we were trying to identify what appear to be the most trauma impacted communities within the city of Meadville. And so we laid all this data over 3 years that we collected it. We laid it down and developed a heat map. And we developed, or we readily saw that there were 5 micro communities within the city of Meadville that had a lot of these traumatic incidences. And about that time, we had Dr. Paul Abernathy from Pittsburgh speak at one of our annual trauma conferences. Now, Reverend Abernathy has been doing some work in the Hill section of Pittsburgh. And anybody who's ever watched the show Hill Street Blues will know what I'm talking about when I say the Hill section in Pittsburgh. You know, it's a trauma infected community, lots of crime, lots of gang violence, lots of drugs, etc. But he was showing remarkable results. And he was at the point, or at the stage, where he was willing to take this model that they had developed over years and train other individuals from communities across the country. And so we went down representing a small city in Pennsylvania. I think there were 5 other groups there representing larger cities from the East and Midwest portions of the nation. It's a week-long training, and we learned how to implement his model here in the city of Meadville. And we call it HOPE. And HOPE is an acronym which stands for Health, Opportunity, Placemaking, and Engagement. And so we started knocking on doors, and we identified this community that we affectionately know as the 5th Ward. It still has its voting designation as its label. None of the other wards are known that way, but this particular community is on the other side of French Creek. So it has that proverbial, the other side of the tracks connotation. It's where there's a lot of poverty, a lot of systemic poverty, a lot of, we don't have a lot of crime in Meadville, but where we do have some crime, that's a hot spot for crime. A lot of overdoses, just a lot of unwell, unhealthy people, and it's in the floodway. So the city has not been investing in it. The infrastructure was deteriorating, and you could just feel the malaise whenever you went into that community. But they also had some semblance of social cohesion. Families had been living there for generations, and they wanted to see improvement. So we identified that as our micro community and began knocking on doors and talking to people and asking what it is they wanted to see and what did they identify as the issues. And then, of course, the pandemic hits. Well, at a time we're supposed to be maintaining physical distancing is not the time you want to be working on a community level project where you're trying to get people connected. So it became a real challenge there in 2020 and 2021. But we adapted. We established a warm line. Using our hotline infrastructure, we got another phone line, and we found 60 or 70 local people who could volunteer as Hope Line responders. And as the calls would come in, sometimes it was, where do I get a mask? We could answer that question. Other times it was, I'm feeling lonely. I haven't talked to my family or seen my family in weeks. I'm beside myself. Then we would put those people in touch with one of our volunteers who did some compassionate companioning and will help those folks work through that. We did that for about a year, and that, I think, was very helpful in helping to manage the mental health crisis that was developing all across the country. We also trained up some community health workers who could go door to door and literally ask people if they're getting to their appointments, are they getting their prescriptions filled? Do they need mental health services? And we were trying to do those warm handoffs and get people connected that way. Then as the pandemic subsided, we were able to actually get out into the community and do these qualitative health analysis surveys. These were rather lengthy questionnaires. Some people invited us into their living room and filled them out. Some took them and then sent them back. Others did them online. There were lots of different ways you could fill out this survey. And we got, I think, 70% of the community, this micro community, covered. And, we got the kinds of results I think we were anticipating. 66% of respondents had chronic diseases. Almost 70% had not seen a dentist in the last year. 40% had a mental health diagnosis. 30% rated their mental health as fair or poor. And so we thought, and then we pulled the community together to share the results with them. And we thought what we were probably going to get was, well, we need greater access to healthcare, or we need clinics set up in our neighborhood. But that's not, in fact, what the community wanted. What they wanted to see was more opportunities, more activities that would build connections where they would get to know their neighbors better. I mean, that was revelatory, right? I mean, this is what we had hoped for, and this is what we thought was the antidote for much of what ails a lot of communities is greater connection. But for them to see it and to come to that conclusion on their own was just a beautiful thing. And so then and this is not a top-down approach. This has been tried before, where groups, the college, other organizations have come into these communities and said, okay, here's what you need to do. This was a bottom-up approach. This was all about, how can we help you get well enough so that you can sustain the opportunities that come your way? And so they wanted to form a resident council that would help steer their activities and focus their efforts so they could have the greatest impact collectively in this community. And they've been meeting once a month, and they've identified 3 to 5 goals that they're going to work on over the next year and a half around this health survey, and a way to build connections between themselves and others. And so just in the last year, they have started an after-school program with buy-in from the school district, who provides transportation. So they're doing tutoring for these kids. They have a weekly coffee hour. We do an annual neighborhood cleanup junk haul. There are many in-kind projects. We've helped people put in pavers and repair roofs, get their yards cleaned up. They do a holiday decorating contest. We now have folks who have learned how to do advocacy at the city council meetings to get the infrastructure repairs that they're looking for. They're starting a community garden, and that's about to be launched in here about another week. In Northwest PA, you don't plant anything before Memorial Day. So that's coming up. We've been able to, with the resident council, establish linkages with healthcare providers, and we're providing employment, or they're finding folks who can come in and do employment and training activities. For example, they identified a banker who agreed just yesterday to do a financial literacy workshop, series of workshops with residents in this community. So these are just some of the things that these residents have come up with on their own, with our assistance, to promote, healthier outcomes for themselves. That's a lot. I should pause and take a breath.
No, that's so fantastic, Bruce. And there's 2 things from that really stick out to me that I just want to draw some attention to. And the first one is community connectedness as violence prevention, which I think is something that doesn't often get talked about enough, or that folks who aren't necessarily in the movement might not think of like right away as like, how do we prevent violence? I think sometimes it's thought about more like, oh, on an individual basis, like we help this one survivor, this one victim, like once they've already experienced violence, but really, building up communities, building up their community engagement, building up the community connectedness, and strong social networks, and having resources helps reduce some of those other risk factors that can lead to domestic violence and other poor community health outcomes. And I just love that that's a focus. And I love that we're drawing attention to that community connectedness as violence prevention. And the other thing that I think is really cool that you all did that I wanted to just highlight was the bottom-up approach, and actually asking people in the community what they need and what they want. We tried to encourage survivor-centered domestic violence advocacy. And I see like that as such a parallel in that with like the community center, like centering the people in the community that you're trying to help and trying to build up. So I think that both of those are just really cool things. And I also wanted to see, Nick, if you have any comments on that. Is this the type of work that you're seeing elsewhere?
Yeah, I mean, we're seeing a lot of programs, or programs kind of do this type of work of really like letting the community lead where they're going to go with their projects. And I do want to thank you, Lauren, for highlighting that, because I really wanted to highlight that as well. That I think is really important and essential to any type of community level work, is letting the community, or ensuring that the community's leading it, and also asking the community what they need, because, sometimes it may not be what you think the community needs, and they actually need something else. I tell this story. I've heard it somewhere. I always say, I know it was at a conference somewhere, but I can't remember who said it, but it was a health department, and they wanted to increase like the activities of like this neighborhood, like get the neighborhood like outside and using the walkways and the playgrounds more. And they got a bunch of money, updated the playgrounds, updated the paths, and the community still wasn't using any of them. And they're like, what did we do wrong? Like, they were like frustrated. So they decided to ask the community, like, why aren't you all using the playgrounds and stuff? We fixed it all up. And they're like, oh, that's really nice and all, but like, we have a stray dog problem in our neighborhood. Like, we don't feel safe going outside or letting our kids go outside. And so so this health department was like, oh, we had no idea that was an issue. So they, then worked with the SPCA, try to help figure out the stray dog issue. But, they would have never known that, and kind of kept spinning their wheels, like I think Bruce was describing, like other organizations in that neighborhood did previously. But when you let the community, lead the projects, it's just going to automatically be more accessible. They're going to be more engaged, and you're addressing the needs that they have and that they actually have, that help lead to, building up that connectedness to each other, right? Like, if it's hard to really build connection with each other, if you're too worried, if you're struggling to figure out, how you're going to fix your deck, right? And then like, if you have a community group that can help fix that deck, it builds that social cohesion, and so it's just, I just wanted to like re-emphasize that, because I think that that's really essential to not just this project, but all prevention work, is making sure that the community is in the lead of it.
Yeah, we have two good examples of that kind of thing happening. One is the drug dealers are leaving this community because the neighbors are journaling. They're noting when people are in and out of these known drug houses. They're taking down license plate numbers. They're making it very uncomfortable for these folks to operate in this community, and so they're leaving. The second was an interesting story. A young man, 14-year-old, his parents, it's an active domestic situation, and there was an incident one night, and he took off, and the parents called the police, and the police were patrolling the neighborhood trying to find him. The boy was too scared to go to the police, didn't really know where to go, ended up going to our counselor advocate who lives in that community, who works that community. She's our community developer there. He found her, and she accompanied him to the police station, and then to the hospital. And so that's too often in our centers, we see folks after the event. And you think, boy, if I could have been there, if we could have intervened during the height of this, perhaps we could have done more. And so there are plenty of examples I could give you where that very thing is happening, where we're in real time able to intervene and help bring the level of violence down and have good outcomes. It's exciting work. When I got out of college in 1982 and started working in a residential facility for adolescents, and I remember thinking, wow, much of what ails society really is around our issues, right? It's dysfunctional homes, it's domestic violence, it's sexual violence, it's child abuse. And if programs like the DV centers around the state could become the central entity within each of these communities that could generate this work, we could we could have a real impact. And so we're getting to do that here. And I thank PCADV for these kinds of funds that allow us to do this kind of seed work. But it's exciting for me after all these years to finally be doing the work that I thought we could do and been wanting to do for 40 years. It's exciting. And it works.
Yeah. And it's so great to get to hear it right from somebody who is in the community, like out in their community, actually on the ground doing these things. And I also wanted to ask, when we spoke offline before, you had mentioned your program's involvement with the school districts up there and how like a really long-term partnership with the district as a whole and getting into the curriculum has really made an impact with that kind of partnership. So I just wondered if you could tell us a little bit about that program and how you all managed to partner so strongly with the schools in your area.
Well, I wish I could take credit for this, but I can't. This was the foresight of my predecessors here at the agency back in the 80s when we first started doing this work in the schools. They had the foresight to go to each individual school district school board and ask that our curriculum be approved. And so we are a part of the elementary and secondary school systems curriculums, particularly their health curriculums, where we get to go in over multiple days and talk about issues in an age-appropriate way that alerts young people to what's appropriate, what's inappropriate, what's safe, unsafe. So, for example, in the elementary schools, and we're there in first, third, and fifth grade. It's a lot of the good touch, bad touch, no go and tell. But what's really important about that work is at the conclusion of these programs, we have a quiet time. And students can come out and speak to the counselor about any concerns they have, about any issues that were raised during our presentations. And of course, you can imagine that generates a lot of child abuse disclosures and mandated reports. Children and youth actually work with us on our scheduling because they know their call level will go up when we're in the elementary schools. And Crawford County has historically had higher levels of child abuse reporting on a per capita level than most other counties. And I'm convinced it's because of all this work that we're doing in the schools. We're just doing a really good job of helping kids identify this early and get it dealt with early as possible. And then that work continues in the middle and high schools. In the middle schools, it's a lot of peer harassment, sexual harassment. You're starting to get into some dating relationships and some of those dynamics of healthy relationships. And then in the high school, it's a 5-day program where depending on the school district, and how much leeway we're given, we're having very frank discussions with young people about consent and what that means. And some of it borders on sex education, but a lot of it's just about healthy relationships and how you navigate all that difficulty and all that stuff that's filtering down to them through social media and the national news, et cetera. And we've been doing this since the 80s. And then we report out every year to the school boards about what we're finding, what the kids are talking about, what the concerns are. And so we've had a very healthy, good dialogue for almost 4 decades now with this work in the schools. And the beauty is we don't have to fuss and fight with them to get in every year. The teachers know that in September, we're going to be calling and we're going to be scheduling these classroom presentations. And so we're reaching 5,000, 6,000, 7,000 kids every year. I have 3 full-time prevention staff and 1 or 2 others that help out. And every day sometimes they come in here first, then they're off to the schools, and then we see them later that afternoon. They're in the classrooms all day long. It's a grueling year, but we've been doing this, as I said, for almost 40 years, and it's just incredibly important work. I'm convinced that a Jerry Sandusky would never survive in a community like this.
That's wonderful, Bruce. If somebody in a different county was interested in implementing some of the things that you have, whether it be something like the Hope Project or a deeper involvement with the school districts or other like broader community group involvement as part of their violence prevention strategies, what advice would you give to them?
Well, I'm convinced that being highly collaborative is the way to go. I want a seat at every table, at every work group, at every committee, every task force. I want to have a seat there, whether it be me or one of my colleagues here at the agency. I just think it's so important that we keep our issues front and center, and that we have input into the solutions that are being imagined and envisioned, and implemented. I think it's important to, so when I first got here in this program back in 2008, sexting was all the talk. And I remember saying to one of my prevention staff, hey, we need to develop some material on sexting and get it out to the schools. And I was picturing middle school age and up. And we developed this brochure, and we got it to the school district, and it went out. Well, a couple of days later, my daughter, who was in second grade, got off the bus, and she says, hey, Dad, I got something from your office. And I'm thinking, I don't remember sending anything to the elementary schools. And sure enough, she has this brochure. And the brochure is called Sexting. And I'm like, I have a feeling this is going to backfire. And sure enough, when I got into the office the next day, the phone's ringing off the hook. The superintendent from the school district is calling, saying their phone's ringing off the hook. And would I please come in and talk to the school board about this? So I get in there, and one of the school board members wants to know why we've distributed this material, and did I think it was appropriate for kids to be reading about sexting. And I said, look, I'll explain to you what I explained to my second grade daughter. I said to her, do any of your friends, classmates have cell phones? And she's like, yeah, Dad, almost all of them. And when am I getting my cell phone? I'm like, well, that's a whole nother subject. But do you know that these cell phones have the capability of taking pictures? And she said, yes. I said, well, you might be in the bathroom, in the stall, and maybe somebody would reach under and take a picture. And then they would share that picture with other people, with other friends. That's basically sexting. I said, so if you see anything like that, tell your teacher or, somebody in school what just happened. And the school board looked at me and says, well, when you put it like that, that makes a whole lot of sense. I said, yeah, doesn't it? I mean, here we are, we're handing kids these powerful tools, these technological tools that have access to the entire world, a window to the whole world. And we give them very little instruction and very little guidance. So this brochure was designed to give people the kind of guidance they need. And I'm convinced to this day, had we called that brochure inappropriate use of cellular technology, first of all, nobody would have read it, but it would have been completely ignored. But because we called it sexting, it got everyone's attention. But we're in a position to be able to have those conversations and do that kind of level of education because we have these relationships. And I'm convinced that everything centers around the relationship. So I guess the first piece of advice I would offer anyone is start building those relationships with everybody. School, judiciary, law enforcement, everybody, even the most unlikeliest of partners. There's got to be some area of commonality, and find that and build those relationships.
That's great. And yeah, since domestic violence doesn't discriminate, can impact anybody, like you said, there's opportunities all over the place to find connections and build relationships with other community organizations, individuals in the community. So that's fantastic. Nick, I wanted to toss it back to you to ask about, what, as we have some more PCADV pass-through funding coming up, what you are looking for and what you hope to see from different programs around the state and folks that might be considering applying for some of that pass-through funding. What are y'all looking for this time around?
Yeah, so this time around we have kind of three major types of applications. One is for a community assessment. One is for continuing projects. And then the third is for culturally specific programs. So our goal kind of with this year is to begin kind of a process of over time, I call it like a leapfrog approach of like building up the capacity of programs and kind of, the community readiness program application, I call a seed funding, for like a new project and beginning it with an assessment of the community as a starting place. And then the continuing funding my colleague Genevieve, I have to give her credit, calls it like the fertilizer funding, right? So something that's already growing and helping that grow into something bigger or just grow. And then with the community specific programs, one of our major approaches from our state leadership, or excuse me, from our state action plan, is to really center social and racial justice in our prevention work. And so we felt that it was important to set aside some opportunities for community organizations that are culturally specific, that are working in communities that have been historically marginalized and oppressed. And so we felt like it was important to set some of that to the side. But the projects that we're looking to fund are, community-based, but also we kind of took them from the CDC's technical package on preventing intimate partner violence across the lifetime. So a very long title, but in it, they talk about the strategies, very similar strategies to what Bruce has been doing of, creating safer environments, creating safer neighborhoods, modifying the neighborhood so that it's, safer for communities to come together. So those are the types of projects we're looking for. And you can reach out to the prevention team at PCADV.com or .org. Oh my goodness. If you're interested in more information about that.
Awesome. Thanks, Nick. And I have one other thing that I wanted to ask you about, because Bruce mentioned gathering data and how much that helped them with their project and assessing the community and like what the needs might be. I wanted to see if you wanted to mention at all our new data visualization site, the statewide one.
Oh, yes, of course, the dashboard. Yeah, so we recently released a dashboard that, sorry, I got really excited that you asked about that. Yes, so this came from the state leadership team and our state action plan. We did an assessment across the state to measure risk and protective factors for domestic violence across the state and kind of try to get county specific levels of risk and protective factors. So our dashboard is really cool. It's kind of a breakdown of different risk and protective factors and the levels of them in the county. So say poverty is a risk factor for intimate partner violence. So we have poverty by county. Food insecurity is actually a risk factor for domestic violence. So we have the percentages of food deserts which basically mean places where there aren't any real grocery stores for folks. And so we have it kind of all mapped out, but we also have a lot of great narrative to make those connections if those connections haven't, if you're having difficulty like thinking about why a food desert might be a risk factor for intimate partner violence. But it's created to be a tool for everyone across the state, whether you're in a domestic violence program or sexual assault program or any health equity field, to kind of get a picture of your county and the state as a whole. So please feel free, please use it. And of course, also give us feedback to let us know how you're using it, if it's working the way you need it to work. And it's very interactive. You can click on the counties and get more information. Very, very cool. We worked with the Penn State Data Center on that, and they helped develop that, who also do our lethality database. I couldn't remember the exact term, but
I believe we call it the homicide dashboard.
Yes,
but yeah, so that I just want to let everyone know that we put a link to that in the chat, but it can also be found on PCADV.org. If you go under about abuse, there's a column called prevention there, and it's the IPV risk and protective factor dashboard, so you can get to it. There's also a call out right now, if you're watching this live or shortly after this is put out, up on the homepage to get to that dashboard and check out all of that data that the prevention team has assembled. So we definitely encourage folks to go and check that out and see where your county stands, and and where we are as a state and how that can impact our prevention work.
Hey, Lauren, also, folks should check out the website HEAL, H-E-A-L-P-A, HEAL PA. It's an initiative out of the governor's office. Their vision is to make trauma prevention the norm all across Pennsylvania. It's a great place to get started if you're looking for doing this work in your own community. And of course, folks can always give me a call here in Crawford County. I would love to chat with them.
Awesome. Thank you so much, Bruce. And we appreciate the willingness to help others. And that's one of the reasons why we want to do these kind of sessions and have folks on like yourself so that you can, we can share what is working for some communities to hopefully, help others, implement similar things to really make a difference where they are in violence prevention. So before we go, I did want to ask both of you. So Bruce, is there anything else that you want to add, something you want to touch on about the prevention work that y'all are doing at Women's Services that we haven't talked about yet?
Oh, well, there's so many things we're doing. We have a state correctional institution in our community. So we're doing some great work. We're embedded in the prison system and doing some great work there. And we're seeing recidivism rates drop. We started a human trafficking task force in our community. I would encourage everyone to have something similar. It's insidious how human trafficking is happening all across this nation, but in every county in Pennsylvania, there's human trafficking going on. And then this trauma work, anything you can do to reorient your community to thinking about trauma differently and how it impacts everything. Somebody asked me, well, why are we training city employees? Why does the secretary in the city building need to have trauma training? Well, think about it. When these people come into the city building, angry, upset, screaming and yelling, crying in tears, who better to understand what may be happening than somebody who's had some trauma training? We all would benefit from having a deeper and better understanding of trauma. And then I think the last thing I would just encourage everyone to do is to think about moving away from a regulatory model where we're all in our silos, doing our thing with target audience A, with funding from this group over here, to a more collaborative, more integrative way of thinking about the work, so that eventually we can get to root causes, which is what I think excites most of us, wanting to get to it at that level. And we've got to be able to show outcomes and data, because at some point the funders are going to say, hey, we've been funding this work for 50 years. What do we have to show for it? What are the outcomes? How can we talk to our legislators in a way that more effectively communicates the value of our work than being able to put it in economic terms? If we can save somebody from going into placement, or if we can prevent homicide from happening in this family, if we can keep people out of the hospital, if people don't have to have drug and alcohol counseling, what's the impact of that on the community? Social impact, political impact, economic impact. We've noticed just in the 5th Ward where we've been working that voter participation is going up. And with voter participation going up, all of a sudden city council is paying more attention, and the mayor's been over there to visit and talk with them. The fire chief's been over there to talk with them. It's amazing how just being able to show that voter participation is on the increase, how much attention that got. So we've got to do a better job of showing outcomes and data. And I would encourage everyone to start collecting that.
Yeah, that's a great point, which can be tough, especially when talking about prevention. Because how do you prove a negative? Like, how do you prove
right.
it didn't happen, right? So I know sometimes you probably have to get, think outside the box of like, how can we show this? Like, we know it's happening anecdotally. We know, from like the working in the communities with the people, like we can see the change. Like, how do we show this then to other people so that they can understand the transformation that's happening as well? So it's very, very good point. Thank you so much, Bruce. Nick, do you have any thing you'd like to add? Anything we didn't touch on prevention wise?
Yeah, just one quick thing that I wanted to highlight that Bruce kind of talked about a little bit at the beginning, is that, Bruce's program is in a very rural area of Pennsylvania, and most of Pennsylvania is very, very rural. And so sometimes when I think we hear, and even Bruce, you talked about like you got the training down in Pittsburgh, and you're like, well, okay, that may work in Pittsburgh, but what about my small town? Like, will that work? And it is. And so I just wanted to like highlight that of projects like these can be very successful, even in places that we don't typically think that they could be successful. And so I just wanted to highlight that because also most of Pennsylvania, as I'm sure our listeners know, is very rural. And so that was just one last thing I wanted to highlight before we ended it.
Wonderful. Thank you again, both so much for joining us today. Prevention is such an important part of the work that we do, and one that often doesn't get enough recognition, often doesn't get enough funding, often goes overlooked sometimes because of the pressing importance of the other side of the work that we do on the intervention side of things. So, I'm just really grateful for both of you for coming on today and highlighting the incredible work that Nick, you and your team are doing at the state level, and Bruce, that you are doing at the community level, as such a great example of what can be achieved when we think about prevention from a community engagement standpoint. So thank you both so much for being here. I really appreciate it.
Thank you.
Wonderful. Have a great day, and thanks for joining us, everyone.
See you.